I hope. Yeah, okay, great. All right, everyone. Thanks for joining us today. I'm Erica Bentley from the Everly College Research Office. I think you all know me. Today we're going to talk about changes to the NIH research management and sharing plans that are going to be coming into effect in January. Let's move on here. I would like to introduce our research office staff. Unfortunately, Dr. Lorimer is traveling today, so he's not able to join us, but Duncan Lorimer is our Associate Dean for Research. He would normally be here with us. Leah Heron is our Grants Administrator. Leah is joining us on the Zoom today. Stone Sheldonbrand is our Graduate Research Assistant. He is always around to help us out. And I'm Erica Bentley, Director of Pre-Award Grant Services here in the Everly College. We do these research roundups probably 3 to 4 times a semester, depending on the semester. So if you have any ideas for future sessions, please email us. We're always happy to do sessions that people are interested in. And if we don't have the expertise to speak, we'll find somebody on campus who does. Our guests today, we were supposed to have Rosemary Castile, the Director of Research Systems and Operational Research Data Services through the WV Research Office. Unfortunately, Rosemary had a death in the family and she was unable to join us. So I'm going to pick up and try to present Rosemary's information. So please keep that in mind. I'm not the expert. I'm here to help, and we'll be working side by side with Rosemary as we implement these new plans. But if we have questions I can't answer today, we will go back to Rosemary and see if she can give us some additional information. So she sends her regrets, and she's always available by email if you guys have questions. Mike Starling is also joining us from the Everly College IT office. He's our lead systems and security administrator. So as you can imagine, when you're talking data management, we're going to be talking a lot about infrastructure and storage and all those kinds of things. So thank you, Mike, for joining us. He and I will be working together with those of you planning spring submissions to help you develop some of these plans. If you have questions, put them in the chat, just speak up, and we'll answer them the best that we can. All right. So you've probably heard, if you're joining us or watching this after we've recorded it, that the NIH has announced some changes to their data management and sharing policy. Previously, many of you have probably worked on a resource sharing plan for your NIH applications, but beginning in 2023, they are going to require some additional information. And I think it's going to take our researchers a little bit of time to get up to speed in order to develop these plans appropriately. So the NIH really wants to maximize the appropriate sharing of data and research results. So that's why they are implementing this new plan. They hope to advance rigorous and reproducible research through these new plans and to promote the public trust in research. So you probably also heard about overarching announcements from the White House about increases to transparency and availability of data resulting from federally funded research. So we're going to be hearing about this from other agencies, but the NIH is the first to have some solid information out there and plans for implementation. So that's what we will be talking about today. So as I mentioned, this will go into effect for applications submitted on or after January 25th, 2023. So that's right around the corner. So for those of you who postponed your fall applications, good news for you, you're going to have to comply with the new regulations if you were planning to submit in the spring. We're going to go over the scope of the changes, how it's going to impact our researchers, and just talk a little bit about what we plan to do to help you as we transition into this new policy. So the scope is going to apply for all research funded in whole or in part by the NIH that results in scientific data, the generation of scientific data. So scientific data is defined as data that is of sufficient quality to validate and replicate research findings, regardless of whether the data is used to support scholarly publications or not. So this may be a change from the type of data that you were reporting on before, but this is the data that's including in the scope of this new policy. It's going to include all research project awards. So all of your R awards, your R01s, R21s, R03, R25, any of those NIH R funding mechanisms. Some career development awards, the K awards, will also have this new requirement. The SBIR and STTRs will also be subject, and research centers funded through the NIH will also be compliant or need to be compliant. Training grants, fellowships, constructions, and these others we see listed here are not within the scope. So keep that in mind. It's going to apply regardless of the amount of funding that you're requesting. It could be applicable to grants, cooperative agreements, contracts, any funding mechanism through the NIH that meets the definition of generating scientific data that is within those eligible NIH mechanisms. Some centers and institutes or offices may have additional sharing expectations. So as always, you're going to want to read your FOAs closely and see if there are additional requirements from that agency that are above and beyond what the expectation is in general from the NIH. And a note, I was sitting on a webinar yesterday and listening, so some of you may have asked this question. They say that it doesn't apply to physical objects, right? So if you have lines of, fish, for example, or flies or anything like that, this does not apply to the actual physical objects, but that research may actually be subject to other policies through the NIH. So just keep that in mind. So what has changed? Well, the title's changed. These used to be in the resource sharing plan with the data sharing plan part of the resource sharing plan. They used to only be required for applications that were $500,000 or more in direct costs per year. That is not the case anymore. This is going to be a data management and sharing plan, and is going to be required for all NIH submissions that fall within those programs we just discussed. They're going to ask for more information. We have a 2-page template now that they have shared. It's a draft. It's not final yet. So they do want more specific information. The cost associated with data management has been more well-defined and allowable now in these new guidelines. And these plans are going to be part of your terms and conditions if the funding is awarded for your project. So keep that in mind. You're going to have to comply with these plans that you put in place when you're submitting the application. You're going to need to revise the plans in your RPPRs every year. You'll submit something saying what progress you've made, what changes you may need to make, and you'll work with the NIH staff to modify those plans as the project goes along. As I mentioned, the allowable costs for these are a consideration, and all the costs have to be incurred during the life cycle of the grant. So we're not exactly sure what that's going to look like, but if you have to keep this data available for 10 years, but your grant is only 3 years, we're going to have to figure out how to include the costs of maintaining that data over that longer period of time in your grant budget. So these are things that we're going to continue to keep an eye on and work with you as you develop your applications this spring. You're going to have to provide more detailed information about the data you're collecting, how you're going to manage it, how you're going to share it. And in some cases, there will be data that is not appropriate to share. You can provide a justification explaining why you believe that it's not appropriate to share. So we'll have to work with you on any justifications. If you have data that, for example, includes human subjects information that is identifiable, there may be an opportunity to justify that that data should not be shared publicly. You need to be aware of any existing data agreement restrictions. So if you're receiving data from another source, we're going to have to keep that in mind. That might be another reason why you can't share the data publicly. So we're going to have to just look at every project individually to see if these restrictions could impact your ability to share the data. The timing of this, we're going to talk about in another slide, but they want you to share the data at the time of publication or at the end of the project period, whichever comes first. The informed consent for human subjects research is probably going to need to be beefed up a little bit. And we can work with the Office of Human Research Protections to make sure that language is appropriate as you develop your protocols for human subjects research. There's also going to be additional institutional oversight of the compliance of these plans. So that's one of the reasons that we want to be involved early on, so we can provide consistent language across applications, talking about how the university is going to assist you in complying with all of these new rules. So it's going to take time. We don't want this to be an afterthought. Many of you I've worked with, and we see the data management plan the day before this is due to the agency. That's not going to be the case going forward. We're going to need to have these data management plans final and ready for review, at least before we submit to OSP through KC, earlier if possible. So this is the chart Rosemary came up with to talk about how this is going to affect you throughout the life cycle of your grant. The green sections are you and I, the PI, and our grant administration support, that's us in the next layer. You also get support from IT. The library is providing resources and assistance, as is the research office. So you're not going to have to do this alone. You'll have help along the way, but there will be, some additional requirements you haven't had to have in place up until now as you develop these plans. I did want to mention that in NIH review, the study section and the peer reviewers will not be seeing your plan. They will see the budget requests for funding for your data management and sharing, but they will not see the plan. The plan will be reviewed by the program administrators at the NIH. So they are the ones who will review that plan and determine whether it is suitable or if it might need to be refined. So it is not part of your scoring. It's not part of that study section review, but it will be reviewed by the program staff. And they say that, you're going to have to, of course, be accountable. If you put it in a plan, you're going to have to report on your progress for that. So as I mentioned before, these are going to be in your RPPRs. They're going to be releasing a new notice of award template that includes the terms and conditions related to your data management and sharing plans. So we'll be keeping an eye out for those changes and for announcements from the NIH about exactly what that's going to look like. And it is frustrating, I think, for everybody that we don't know everything we need to know. The NIH hasn't given us all the guidance that I feel like we need at this point, but they are continuing to provide more information, and they've got several webinars, and they have a pretty robust website that we are keeping an eye on, and that we'll be sharing information with you. I'd recommend that you go in and take a look as well. So, any questions about any of this so far? No? Okay. All right. So the costs of managing this data and sharing it publicly, of course, it's going to have a cost. And I know I've heard from several people who are concerned about the costs and, where you're going to store the data, how you're going to make it publicly available, which repositories you're going to use. So we are hearing that we're allowed to include costs for data curation, developing the supporting documentation, formatting the data, getting it ready to share publicly, de-identifying the data, transmitting the data. So these costs could be personnel costs, but there could also be infrastructure costs that could be included in this. So that's why we want Mike as part of the team here to help us make sure that we have the infrastructure set up appropriately for your data as you go into these applications. Mike, do you have anything else you would like to add?
Not really. We're still trying to figure out where we're going to store this data, what the appropriate like third party resources are, and what we can do in house as well. So we're still working on that, and hopefully should have some answers here soon.
Right. Okay. Well, as with all grant costs, the unallowable costs include costs that would normally be included in your F&A costs. Costs associated with the routine conduct of research is not included, and costs that are doubly charged or inconsistently charged as direct and indirect costs are not allowed. So this is the same as any other grant budget. We have to make sure to consistently treat our direct and indirect costs separately. In the budget, I know everyone is excited about getting into the nitty gritty. That's what I'm like, where is this going to go in the application? Your costs for data management will be in section F on your R&R budget. It'll be called data management and sharing costs. I'm not sure if they'll add the line or if we need to enter it in, but we'll help you with that. And if you're submitting a budget that is a modular budget, then you'll need to explain the costs for your data management in an additional narrative justification. That's the same justification that we develop if your modules aren't the same every year, or if there are exclusions from the modified total direct cost base. We'll also be including the justification for the data management plan and sharing in that narrative document. The NIH mentioned in a webinar yesterday that there have been and will continue to be specific funding opportunities for data sharing and management costs. I'm not currently aware of what those are, so I need to look into that a little bit. And they've also said that there's currently no budget caps on the amount you can ask for your data management and sharing plan costs. But they also haven't said whether they will increase the modular amounts or if they will increase the $500,000 a year cap that is generally in place for R01s, unless you get additional approval from the program officer before you submit. So they say they're going to be releasing that information in an FAQ. We haven't seen it yet, but again, we're going to keep an eye on these things and keep you all informed as we go along. So we talked about this just very briefly. When will the data need to be shared? It will need to be shared, the NIH says, as soon as possible. If you have an article published during the award period, the data should be made publicly available no later than the time of publication. That is whether it's in online format or in print. Only a peer-reviewed journal triggers that data sharing expectation during the award. If you have a preprint, but it's not published yet, that does not trigger the release of the data. But if you have a preprint and your award is ending, the end of the award will trigger the need to publicly release that data. Does that make sense? Anybody have questions about that? No? Okay. So as we've said, there's a lot of moving parts. This is all just starting, but the requirements are going to be in place very soon. So there is a group, the DMS committee, that is meeting every other week to review new information and come up with guidelines. So you can see the members there on the right. Mike and I are part of this group. Rosemary is leading it. We're joined by colleagues from OSP and from health sciences and engineering. So we are all together in this and trying to help come up with ways to support our faculty as they transition to these new plans. We're also following changes at other federal levels. For example, you guys have probably seen that White House memo from the Office of Science and Technology that they're going to require all federal agencies to begin to implement plans that publicly funded research will need to be made available to the public. So I think the NIH is just the tip of the iceberg. This is going to be flowing down to other agencies. So this committee is going to be keeping an eye on all of these changes and reporting back to everybody as we learn more. Our next meeting, I think, is next week. So there's a lot of information to share. And we really just want to be there for our researchers and make this transition as simple as possible, even though we may not know exactly what is required at this point. All right. So as I mentioned, we're going to continue to share information with you. We did send a survey out asking those of you who have indicated that you are planning a spring submission, are active NIH awardees, and to the STEM departments or the departments that are planning or have submitted NIH applications in the past. If we've missed you, we do have a Qualtrics survey that I can share with you, or you can access it via this link to let us know when you plan, what quarter you plan to submit. Will it include human subjects research? And then we're gathering that information in order to plan one-on-one consultations with people who are going to be submitting this spring. So we'll reach out to you after you've submitted that plan or that survey, and we'll find a time for Mike and I to come and talk to you. Rosemary may be joining us, and we just want to find out, what your plans are, and then that'll help us determine how we can help you best. Again, you can always contact Rosemary if you have questions. That link down there at the bottom is the NIH DMS site, which is fantastic. There's a lot of great resources there. So if we call you and say, hey, we want to meet, it would be great if you were prepared. So you could start thinking about this long list of questions. I know. We will also be developing a Qualtrics survey that we'll send out prior to our meeting that will ask you these same questions and maybe, modified slightly. But this is the kind of information we want you to be thinking about as we get closer to these spring deadlines. So I'm going to leave that up on the screen, let you guys digest all of those questions. I can also share the list with you, but you'll be getting a Qualtrics survey from us prior to scheduling a meeting, so we have an idea of what we're looking at. Some of you are going to have human subjects, some of you will not, some of you will have qualitative data, other people will not, and we're going to have to approach each of these plans individually and help you come up with the appropriate responses that will hopefully satisfy the NIH requirements. Any questions yet? Yes, we will send a copy of the PowerPoint out to everybody. Thanks for that question. Especially because I want you to have access to these links. The NIH has made some really great resources available, and they're continuously updating their sites. I like this NIH tool to help you determine which policies apply. This is not just the data sharing plan policy. This is also the genomic sharing. So you can go and do this nice little checklist to determine which policy applies to your research. You can see a copy of that template of the DMS form, this other link. They have a list of the NIH's supported data repositories, so you can search that list by keyword. Different institutes and centers have recommendations for different repositories. Of course, WVU has a repository, and the libraries will be also sharing information about the repositories that are available for your research. So I'd recommend keeping an eye on these sites, and we will update as we can. Andrew, I see you have a question.
Yeah. So I guess I'm a bit concerned that, I know right now things are kind of up in the air and they're evolving. We don't exactly know what's going to be required for what kind of data, but I'd be a little bit concerned about having a decentralized approach or a bottom-up approach to how we should be doing this. I don't know if it's the way I might do it might not be. I just having 10 different ways of doing it seems dangerous. I think it, especially as well because we have all the data that we collect, and then some of it goes into papers, but some of it might need to be the next paper, and so we have duplication of data. And so if it's just the data for that one specific paper, wouldn't it be good if we had some centralized place that everyone has to, that everyone at ECAS goes to, right? Rather than I use one approach and someone else uses a different approach.
Right.
So I guess that creates infrastructure that needs to be maintained. It sounds like 2 times as long as the standard NIH R01 lasts.
Yeah.
And there's the cost of maintaining that infrastructure, or do we just go with some sort of cloud service? And then anytime anybody publishes in ECAS, the raw data needs to be put with, you know, I mean, I know right now we're in the planning stage, but my 2 cents is that I think the college should be thinking about how we come up with a uniform approach with, you know, guidelines for raw data storage, I guess, is all I'm getting at, rather than being like, well, you do it one way and I'll do it another way and that sort of thing.
Right. And without knowing the scope of what we're looking at this point, it's hard for me to have a response to that, but I appreciate the input. Mike, do you have anything else you want to chime in on about that?
No, just that we're working on something similar to that. Yeah, I would like to have a uniform approach to how we do this, but based on the research, it's going to have to be done on a case-by-case basis from what I'm seeing.
Yeah. And as we learn more, we're going to have to just determine, you know, what resources are out there, what's best. I don't know that the institution's going to have a specific recommendation. We could think about it at the college level, but everybody's research is just so different. I don't know that a one-size-fits-all approach will work for everybody, but I do appreciate the comment, and this is what we want. We want to hear from people and the concerns and recommendations that they have.
Yeah, we could always pop up the indirects to 54%. Right.
Right. And this isn't something that I've been part of a discussion about, but I would assume that the indirect cost rate agreement could be modified to include some more of these costs, which could potentially increase our rate. Yeah.
I mean, the indirect cost rate I had as a postdoc at Mount Sinai was 65%.
Yeah.
Right. So it's not like we're asking some crazy amount.
Right. Yeah, and that's a negotiation with the university and the DHHS. If we are increasing our infrastructure to support these data management plans and the sharing of the data, it would make sense to me, but I'm the person at the department level. I'm not sure what exactly would be added to that calculation. But I would envision that it could certainly have an impact on our indirect cost rate. Yeah. All right. So, any other general questions? I'll share our QR code for our website. If you've not visited it, please check it out sometime. Let us know what you think. You can always follow us on Twitter. Check out our newsletter every other week. We will continue to put announcements about this in the newsletter and other things, but I know you guys are really busy and you don't always have time you know, to do these things. So don't hesitate to reach out to us individually if you have questions, concerns. We will be reaching out to those of you planning spring applications to have these more in-depth one-on-one conversations. And I hope that we'll be updating our website. We have a data management and sharing site, a page, but it's going to need some updates. We haven't gotten around to that yet. So you'll probably just see a NIH updates coming soon notice at the top of the page, but we do want to include some additional resources there as these plans change. So any other questions, comments, grumbles, thoughts? It's hard to present about changes coming down from the federal level that we have no control over. We have to comply or, you know, not ask for this funding. And I don't think that is an option for anybody. Here is our direct email. If you want to email us anytime or call us or stop by, we usually have someone in the office every day now here in Woodburn Hall. So stop by and say hello. Let's see, do we have any other questions in the chat? Oops, didn't mean to scroll back. There we go. Yeah, thank you guys for coming. I will share a copy of the PowerPoint. We will record this video and share it out there for everybody who wasn't able to make it. So if you're watching the recording and you have questions, please reach out to us. And I know you guys are busy. I don't want to keep you if we don't have any other questions or comments. No? Okay. Well, I look forward to talking to you guys individually. keep your eye on, our resources and updates, and always read the emails that come from me because it's got important information. All right. Thank you guys. Have a wonderful afternoon.